Good afternoon, and thank you so much for inviting me here today to talk about lung cancer prevention, screening, and early detection. I'm Carolyn Aldige, the founder and CEO of the Prevent Cancer Foundation, located just outside Washington, D.C. But I also have the honor of serving as vice chair of the Global Lung Cancer Coalition, an organization comprised of over 30 NGOs from more than 30 countries. And we were delighted to recently welcome FairLife into the coalition. We all know that up to 50% of cancer cases are preventable, and about 50% of deaths from cancer are preventable. Yet every year in this country, 1.8 million Americans are diagnosed with cancer, and more than 600,000 people will die from these diseases every year. Imagine if all cancers could be prevented or detected early enough to be successfully treated. We do imagine, we dare to imagine a world without cancer. We all know that lung cancer is the leading cancer killer globally. Annual deaths from lung cancer globally are 1.8 million, which is 18% of the total mortality from lung cancer in the world. In the US, that number is 132,000 annually, and in Greece, it's just over 7,500. But that's enough to make Greece rank as the country with the 11th highest mortality rate from cancer. Lung cancer has been transformed from a rare disease to the leading cause of cancer incidence and mortality worldwide. So how can this alarming statistic be reversed? Well, of course, we all know that if everybody stopped using tobacco products tomorrow, that would reverse the alarming statistic. But because we all know that that's not likely to happen, we have screening with low-dose CT. And that's how we help solve this lung cancer burden. We screen those who at high risk with low-dose CT. I'll share with you a timeline for lung cancer screening in the United States. It was quite a lengthy process to develop a national lung screening program. In 2002, the National Lung Screening Trial was activated at a cost of $250 million with over 50,000 participants who were randomized to either LDCT or chest X-ray. In 2010, the trial reached its primary endpoint of a 20% reduction in mortality and was halted. In December 13, the cost began to be covered by private insurance, and 14 months later, in February of 2015, the cost began to be covered by government insurance. So I'd like to pose the question, how does the Prevent Cancer Foundation work to advance LDCT screening in the United States? We hold a signature conference every year, a quantitative imaging workshop, which is a forum that advances quantitative LDCT screening for education and management of early thoracic disease, not only lung cancer, but also COPD and cardiovascular disease, which can be detected in the same set of images as lung cancer. And these are 3 of the 4 leading causes of cancer death in the US. We also work on screening in the community. And about 2 years ago, we made a grant to a small county in northern Michigan. A grant of $25,000 enabled the McLaren County, Michigan Hospital to educate patients about lung cancer signs and symptoms and to screen 16,000 individuals at high risk of developing lung cancer. Well, you might well ask, who is at risk of developing lung cancer? In the US, that is defined as individuals who are 50 years of age or older, are current smokers with a 25-pack-year history of smoking or use of other tobacco products, and are former smokers who quit no more than 25 years earlier. We also give voice to early detection. We influence public policy at all levels. We cultivate grassroots advocates, and we connect with other national cancer organizations. Our priorities are to increase funding for lung cancer and screening research. We work to reduce health disparities, and we support legislation that improves access to screening and care. Yes, we dare to imagine a world where no one dies of lung cancer. Do you? Thank you very much for your attention.